Namaskar. My name is Dr. Rohit Bansil. I'm a senior consultant neurosurgeon at BLK-Max Super Specialty Hospital, New Delhi. So I'll be briefly talking about Parkinson's disease today. So simply put, Parkinson's disease is a neurological disorder which happens because of imbalance of certain chemicals in the brain. So the result of which is the patients start with having tremors in the hands. So the tremors can usually progress and becomes generalized, and then slowly it progresses to stiffness in all the limbs, and gradually a person is unable to carry out his routine daily activities, and this leads to depression. So it's a progressive disorder, but then again this is not a cause of concern and not to be worried about. And with the advanced diagnostic techniques, it's very possible to diagnose this condition in a very early stage. And as soon as it is diagnosed, the treatment is essentially started with the medications. And most of the patients have a very good control with the medications, and the outcomes are extremely good. However, in a very few subset of the patients, the medications don't respond. They don't respond well to the medications. So the neurologist or the physician has to go on increasing the dose of medications. And in some patients, we call them as refractory Parkinson's disease, where the patient doesn't respond to the medications. In that case, even despite giving high doses of medications, the disease progresses. So that is a very, very detrimental condition. But again, like I said, that's where our role comes into play as a surgeon. So the role of surgery in Parkinson is again very well defined. So it's mainly reserved for the refractory Parkinson's cases, like I suggested earlier. So the surgery is again of various types. It could be a lesionectomy, where the area of the brain which is causing those abnormality in the chemicals is surgically removed, or simply a better and a more newer and a better technique is the deep brain stimulation. So in deep brain stimulation, basically we use computer navigation and all the latest techniques and advances to place an electrode in the brain, and that electrode is basically connected to a small battery which is placed under the chest like a pacemaker, and that device basically keeps on sending electrical impulses to the brain, and it suppresses the activity of the area of the brain which releases those abnormal chemicals, as a result of which the balance in the chemicals in the brain becomes absolutely normal, and patients have seen a remarkable improvement in the symptoms after the surgery. So in long run, the quality of life improves, the daily your productivity improves, and the results are remarkably good. Thank you very much.